This e-panel discussion is all about AI to fight against COVID-19. We all know that AI is playing an important role in area ranging from diagnosing the risk to treating the depression, from delivery of the services to drug discovery. So today we have a fantastic panel here with us and our worthy Vice Chancellor Dr. Harsh Sadawarti as keynote speaker. So we would love to start our panel discussion with his talk.
So, very good morning. So, I'm going to talk about mobilizing artificial intelligence to fight against corona crisis, COVID-19 pandemic. So, of course, with the COVID-19 pandemic, we have to explore the contribution of artificial intelligence in the public health crisis. So, we came across promising endeavors involving such algorithms from mining for insights through tracking the spread to detecting the infections by cuffs. It's sensible to be vigilant and to know about the potential privacy issues and dangers that come with the use of new technologies in unprecedented times. However, these developments we elaborate will help us to prepare for future outbreaks. So, AI predicting outbreaks. It would what is now a quasi profitable tale. It was an AI company that issued the first warnings of an outbreak. Blue Dot uses algorithm to sift through hordes of news reports, airline data, and reports of animal disease outbreak to detect trends. These were then analyzed by epidemiologists who then alerted the company clients. The software even correctly predicted the virus like likely path from Wuhan to Tokyo after it first appeared. So, as the disease spread, other organizations turned into similar situations. A team of researchers fed an algorithm with air travel and smartphone movement data to explore how the disease could spread from Wuhan to other cities soon after it appeared. And another team used on AI to model COVID 19 spread from case reports, human development, and public health interventions. This helped show how travel restrictions hampered this growth. So by employing such methods, authorities can take a better insight into forthcoming disease outbreak. So aiding in diagnosis with radiological scans, facial analysis, and coughs. So identifies those positive with COVID-19 is of urgency to stop cross contamination. However, with burdened healthcare institutions, identifying the infected prove to be challenging. Hospitals are overflowing with lines of patients showing up various ailments, most of whom don't need additional care. So AI can help in the screening and triage of relevant patients in these cases and alleviate the pressure on hospitals. Terming it a powerful tool, artificial intelligence is doing wonders. So, teaming with Microsoft, Providence launched an online tool to distinguish those who could have been infected with COVID 19 from those with less threatening condition. A group of researchers and engineers from San Francisco, they launched an initiative called Curve for the Cure. Yep, you have guessed it. They aim to develop a COVID 19 diagnostic tool based on cuff audio. Once enough recording from people tested positive or negative for the illness have been collected. It will be the task of a machine learning algorithm to detect nuances to differentiate between those people and aid in diagnosis. So now I'm going to talk about the resource management and predicting severe outcomes. So as we all know, the lack of protective equipment and shortage of hospital beds and overloaded ICU are worldwide phenomena these days. And with AI-based forecasting tools, hospitals can better manage their resources. So I'll talk about a software, Quintus. We developed a software program aimed to help the hospital administrators during the pandemic. This model takes into consideration the patient influx from COVID 19 and related death and forecasts its effect on the hospital's capacity like beds. So researchers published their findings on creating artificial intelligence framework to assist in rapid clinical decision making. Their predictive models use real patient data to determine who will develop acute respiratory distance syndrome. We say ARDS, a severe complication in COVID 19. And these models achieved 70% to 80% accuracy in predictive severe cases. Those patients in this way could be prioritized for specialized support. So, speeding up vaccine research in a move to medical research around COVID 19 on the fast track, the organizations like Microsoft, Allen Institution for AI set up a free comprehensive database with over 29,000 scientific articles. So, believed to be the most extensive collection of research papers, this COVID 19 Open Research Dataset CORD 19 aims to facilitate the research work by being an easily accessible resource for scientists. Moreover, it allows machine learning algorithms to mine for insights which can aid towards crucial research. So, be it for vaccine development, transmission trends, or even unusual associations. So, combining machine learning and network science, the Barabasil lab is looking for new drug candidates. Again, the novel coronavirus. So less than 10 days since the team refocused it, network medicine tool set for this purpose, they already have a list of drugs to be tested in human cell lines in an experimental lab. So artificial intelligence has proven to be a impactful tool in fighting against the COVID 19. So, a lot of research is going on, and people are working day in, day out to curb this pandemic. So, hope artificial intelligence will win the game and we all will be free from this disaster and this dreadful disease COVID 19. Thank you very much for your patient hearing.
Thank you so much, sir, for your views. So now I would like to invite Harsh Sandhu to share his view how AI can help to fight against COVID-19.
So during this time, we need to stay at home because of obvious reasons. And because of that, a lot of teenagers and even adults are developing depression, which makes them unproductive and it affects their physical health too. I do have solution for that, but uh, before that, I want to start with things which make your depression worse. Inactivity, poor sleep habit, social isolation, poor diet, and rumination, which are negative thoughts because everyone is scared these days. Depression drains your energy and makes you feel empty. I want to help people because this is something I've been dealing with too, and it affects millions of people every year. The key to self treatment for depression is to be open, accepting, and loving towards yourself and whatever you are going through. Now, it's common, people feel tired, and self treatment is not their first option. So, I was thinking about creating a website or an app which lets people who want to help others and people who need help to come and talk about their life and what they're dealing with. This is a type of social interaction, and it will help them a lot as it will terminate the factor of social isolation. Other solutions can be rewarding. People can be rewarded for the tasks they perform, and this will encourage them to do more work. People who are depressed can understand the problems of others better because they're going through the same thing, which will make them a perfect volunteer. So they can get help and they can help others, which brings happiness to them and others too.
So thank you so much. I would like to be productive in this situation. So coming to Neha, what are your views?
Good morning, everyone. As we all are gathered here in Touch Me Not environment because of COVID 19 to have a panel discussion on AI. Basically, we are facing lots of problems during this lockdown just to stay safe so that we could live healthy life. We are facing mental and psychological problems too. Though every one of us are managing this stressful situation, COVID-19 is a major global public health problem. To fight with China is actively using advanced digital technology such as AI, big data, cloud computing, blockchain, and 5G. Coronavirus is creating massive frictional ripples in almost every sector, from tourism to transportation, the supply chain of export and import, healthcare, IT industries, etc. So, we are in urge to come up with innovative solution to mitigate the situation. One such solution is the usage of drone. Basically, our basic motto is to reduce the human to human contact or to limit the contact. So, as we know, drones are basically based on AI. Let me tell you what is AI. It is not the technology itself, though the knowledge and creativity of the humans who use it. Artificial intelligence has the potential to help in tackle the pressing issue raised by COVID 19. As the news came last week, Alibaba developed AI diagnosis system promises to detect new corona cases with an accuracy rate up to 96%. We can use drone in almost every sector, medical field, we can use it for consumer delivery product, we can use in agriculture. Thank you.
So thank you so much. It seems very interesting that they are using drone in this situation also. So now I want to come to Nindya Sharma about her views.
Good morning, everyone. Thank you. Well, I'm going to talk about a project that is an AI based app that could smartly help people manage their grocery essentials during this time. It's going to give you a list of things you need in priority order list. It is going to ensure and notify when an essential item runs out. It would give you alternative list for groceries that may not be available at your home. It is going to help you manage your essentials by giving you food plans according to the things available in your home at that moment. It will ask you if you want to automatically send orders of groceries that you have run out of to the nearest daily needs store. And for people who have fitness goals during this quarantine, it would also help them make diet plans according to the ingredients that are available. Thank you.
So it's amazing. Like AI can help us to even maintain our grocery at our home. So last but not the least, I want to come to Lotte just to share his view how AI is helping in his current situation.
Thank you very much, sir. As you all know, my name is Lotim Kuka. I'm doing PGDC at City University. These are tough and crucial times, and where everyone is suffering from this pandemic of COVID-19. This pandemic has caused a lot of problems, and we, as people of technology, are coming up with different ideas, as you heard earlier from my colleagues, to fight against this pandemic. So, using artificial intelligence, I have come up with an initiative of creating an algorithm that will efficiently help us fight this pandemic. The algorithm's main aim is simply to smartly control crowds by calculating the possibilities of one contacting the virus in a given location. Basically, the algorithm will have four main parts. Okay, firstly, it will classify the data given, analyze it, then pass it through a regression algorithm, then finally it will predict. So this will mainly be done for the police and for the people, and as well as the doctors. Okay, so the algorithm will ensure that policemen are sent to locations where they're mostly needed, or locations that have high crowds or large crowds where people are gathering in very large numbers. To control that crowd, the algorithm will send data to the police and tell them that in this place you are needed the most, rather than the police being wasted in areas that have almost 0% of anyone contacting the virus. So the algorithm will also send weekly reports to the hospitals and the doctors to give them an idea of how many cases they might be receiving, to help them efficiently manage their equipment and their bed spaces. So the algorithm will also be able to send data and notifications to the people, the common citizen, telling them that this place is highly crowded and you have this much percentage of catching the virus. This way will avoid having a lot of people in a particular place and will help us fight the virus efficiently. So basically, if this is implemented successfully, it will go a long way to help us reduce the cases that we'll be receiving of COVID-19. So basically, that's the idea that I am working on, and hopefully it will help in giving us better results than we have now. Thank you very much.
So thank you very much. So now AI is helping the police too. So now we have a full-fledged views of our fantastic panelist. So now Dr. Poonam Ratan, HOS School of Engineering and Technology, will conclude this discussion.
Good morning, everyone. Well, it is rightly said that a crisis provides an opportunity to researchers. This pandemic, COVID-19, has become a biggest problem to tackle for almost all countries of the world. But at the same time, it has flourished one sector at large, that is research. So this first great crisis of 2020 provides a great opportunity for digital technology too. Researchers, young researchers at state universities are also participating in this. So as it is rightly said by Harsh, that AI can be used for coming out of the depression. Lotte has rightly said that AI, artificial intelligence, can find out the areas crowdly populated with the crowd or the people, congested areas. There they can help the government to come out with the solutions that, yes, they can handle the situation in a different way. That instead of spending their energies in a less populated area, they can spend their energy in more populated areas. India has come out with a very good solution of ordering groceries online. What else person can do? So AI is replacing almost every sector in the industry or at the public places, even in the houses also. I think this is a great opportunity for the researchers. No doubt, COVID-19, we are struggling with the life saving. Everybody is running towards the diagnosing COVID-19. But yes, we are implementing AI in other ways also. I would like to extend my gratitude towards our worthy Vice Chancellor, Sir Dr. Harsh Sadawarti, for sparing his time, and our young researchers and panelists, Neha, Nindya, Lotte, and Harsh. Last but not the least, I would like to thank Dr. Harmeet Singh for sparing his time. Thank you everybody.